Hi, my name is Davey Potts, and I'm going to be doing a head-to-toe assessment today. Before I begin, I'm going to scan the room, show you that there are no note cards anywhere. No cue cards or anything. Okay, so before I begin, I'm going to check the patient's chart for an order. I'm going to wash my hands, provide for privacy, and I'm going to check the patient's wristband. Can you tell me your name and date of birth?
Austin Fabinski, 5/27/90.
Okay, good. And can you tell me what brought you in today?
Physical.
And are you in any pain?
Nope.
Good. I'm going to first start with neuro. So, do you know where you're at today?
The hospital.
And do you know who the president is?
Trump.
Do you know the season?
Winter.
Okay. And look, so that means that my patient is ANO times 3, alert and oriented to person, place, and time. He appears to be relaxed. His posture is relaxed. His facial expression is relaxed. No grimacing, no guarding, so it doesn't look like he's in any pain. He's dressed appropriately for the season and for the occasion, more so for the occasion. He appears clean and well-groomed, no twitching or involuntary movements. His speech is clear. He thinks logically. He can answer my questions logically. And he scores a 15 on the Glasgow Coma Scale because he is alert and oriented times 3. He is able to follow commands, and he's able to follow my commands. I just gotta plug this in. Follow commands, and he's easily aroused, so when I don't have to do much to have him open his eyes or respond to me. Moving on to skin. Do you have any dry skin?
Nope.
Do you have any itchy skin?
Nope.
Any changes in skin?
Nope.
Any changes in moles?
Nope.
No sunburns?
Nope.
And you wear sunscreen when you go outside?
Yep.
Okay, good. No skin cancer?
Nope.
Okay. So looking at the skin, it's true to ethnicity. It has a nice pinkish undertone. It is, there doesn't appear to be any lesions, bruises. It is intact. When I feel it, it is warm and dry. The hair is evenly distributed. It is smooth and shiny. No hair loss. Pinching the skin on the clavicle to check for turgor. There is no tenting, so skin is mobile and elastic. Alright, so now moving on to the head. Have you ever had any trauma to your head?
Nope.
Any surgeries?
Nope.
Any headaches?
Nope.
Dizziness?
Nope.
Alright, I'm going to palpate your scalp and let me know if there's any tenderness.
Nope.
Alright, no tenderness and no lumps or bumps or lesions of any kind. Moving on to the eyes. Do you have any troubles with your vision?
Nope.
Do you wear glasses?
Nope.
Do you ever get dry or itchy eyes?
Nope.
Do you ever have pain in your eyes?
Nope.
Any redness or swelling in your eyes?
Nope.
Okay, good. So I'm going to have you follow my pen light. So he was able to follow the 6 cardinal gazes, and his eye movements were smooth. There was no darting of the eyes. So cranial nerves 3, 4, and 6 are intact. Now I'm going to shine the light in your eyes. So the pupils were equal. They are about 4 millimeters in size. They're round. They're reactive to direct and consensual light. They're also accommodating. When I move the pen light closer to his face, he was able to accommodate for that. Looking at the outer structures of the eyes, the eyelashes and the eyebrows, those are evenly distributed, and they are there's no hair loss there, so that's a good finding. Looking at the sclera, it's a nice white color. The conjunctiva is a nice pinkish color. There's no discharge from the eyes. Looking at the lens of the eyes, they're clear. They're not cloudy or anything, so no cataracts. And the iris is also blue color. So moving on, we're gonna go to the ears now, and also if the data that I collected prompted me to further my assessment, I would have him perform a Snellen eye chart, but the assessment doesn't prompt me to do that. But since he has no trouble seeing, I would say that cranial nerve number 2 is intact. Okay, so now I'm going to move on to the ears. Do you have any trouble hearing?
No.
Any discharge from your ears?
No.
Any trauma to your ears?
No.
Any ear infections?
No.
Oh, good. So I'm going to look at the ears. So it looks like there is no sebum buildup. There's no drainage, no foreign objects. There is no deformities of the ears, no cauliflower ear or anything like that. They are symmetrical. They are in line with the outer campus of the eyes. I'm going to perform the whisper test now. Can you tell me what I say and what ear I say it in?
Apples in my left. Oranges in my right.
Okay, good. So that is cranial nerve number 8. So that is intact. Going back, I'm going to palpate the TMJ, and I'm going to have you open your mouth. Okay, close. So there was no clicking. He was able to do that smoothly and symmetrically. Now I'm going to touch your face with my nail and then the pad of my finger. Tell me if it's sharp or dull. Okay? And where it's at.
Dull on my nose. Sharp on my chin. Sharp on my forehead. Dull on my cheek. Dull on my cheek.
Okay. So he has sensation in his face, and he's able to open and close his mouth. So the TMJ is good. So cranial nerve number 5 is intact. Okay. So moving on to the nose now. Do you have any trouble smelling?
Nope.
Okay. Do you have any nosebleeds?
Nope.
Do you have any sinus infections?
Nope.
Usually. Do you have you had any trauma to your nose?
Nope.
Any surgeries?
Nope.
So Since there is no problem with smell, cranial nerve number 1 is intact. I'm going to now look up your nose. Can you lean your head back? Okay. So there is turbinance. The septum is not perforated. It is not. There's no deviation of the septum. The membrane is pink and moist. There's hair that's evenly distributed. There's no drainage or bleeding or anything like that. The outside of the nose, it's symmetrical, and the color is consistent with the face. Going back to the ears, I'm going to push down on the tragus, pull on the pinna, and push down on the masseter process. Okay, and there is no pain or tenderness?
No. Okay, good.
So now moving to the mouth. Do you have any trouble swallowing?
Nope.
Do you ever have any bleeding in your gums?
Nope.
Do you ever get any cavities?
Nope.
How often do you see the dentist?
Twice a year.
Okay. And now I'm going to look inside your mouth. Okay. So can you open it and say ah? Okay. So he was able to say ah. His uvula rose, and his tongue was midline. So cranial nerves 9 and 10 are intact. When I looked at the buccal membrane and the pharyngeal wall, the tongue, and the uvula, they were all pink and moist, and there was no lesions on them or anything. There was no white spots or red spots on the pharyngeal wall or anywhere in the mouth. The hard and soft palate were also pink and moist. The tonsils were pink and moist. They were a +1. The teeth were white, and it didn't appear that he had any dental work done. No crowns or fillings or anything. No cavities. There's no tartar buildup or anything or plaque buildup. Okay, looking at the lips, they are pink and moist. There's no cracking or dryness there. So that is good. That's a normal finding. Moving on to the neck now. Do you ever have any pain in your neck?
Nope.
Have you ever had any trauma?
Nope.
Any surgeries?
Nope.
Do you have limited range of motion in your neck?
Nope.
Good. So I'm going to have you turn your head against my hand. Okay, and other side. Okay, good. So he has full strength and range of motion in his neck. Can I have you tilt your head back and swallow? Okay. So the trachea is midline. There was no deviation of the trachea. There didn't appear to be any goiters or enlargements. You don't have any thyroid issues, right?
No.
Okay, so no thyroid issues that prompt me to do a further assessment of the thyroid. Now I'm going to palpate the lymph nodes. So this is the pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, superficial cervical. Deep cervical chain, also the other side. Posterior cervical and supraclavicular. and I didn't really feel anything when I palpated those, which is a normal finding. If they were to be hard and immovable, that would be an abnormal finding. That could indicate an infection or cancer or something like that, or something like that. So, can you move your head like this? Okay. So he also has range of motion, That's more range of motion in his neck that he has. I'm gonna have you shrug your shoulders. Okay. So he has strength and range of motion in his shoulders. And I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
Okay. So cranial nerve number 12 is intact. So before I finish the head, ears, eyes, nose, and throat part of the assessment, I'm going to go over the cranial nerves. So the first one is a sense of smell, which was normal. The occipital bacular nerve, which so his sight is normal. 3, 4, and 6 is eye movement, which was also normal and intact. The 5th one was the TMJ, which is also intact. The 7th was facial movement, the eyebrows and the cheeks, puffing the cheeks, which is number 7, which is intact. 8 was the whisper test, that was intact. 9 and 10 was saying ah and sticking out his tongue and having the uvula rise, and that's also the gag reflex. So 9 and 10 are also intact. 11 was shrugging the shoulders, which that one was intact. And 12 was light, tight, dynamite, which is also intact. So I'm going to ask you a few questions about your chest area. Do you have any chest pain?
No.
Do you ever have shortness of breath?
No.
Do you ever have a cough?
No.
Do you ever feel short of breath while laying down?
No.
Do you ever feel fatigued?
No.
Any dizziness?
No.
So moving on, I'm going to now just inspect the chest. Seeing that the skin is consistent with the rest of the body. It is true to ethnicity, no lesions, no bruises. The skin is warm and dry. And also noting that at the apex there was no heaves or any lifts. So that's a normal finding. Now I'm going to auscultate the heart sounds doing the ape to man technique. So the A is the aortic valve, which is the second intercostal space, right sternal border. The second is the pulmonic valve, which is the second intercostal space, right sternal border. The third is Erb's point, which is third intercostal space, left sternal border. The fourth is tricuspid valve, which is the left sternal border, fifth intercostal space. And the last one is the apex of the heart, and it's the mitral valve, which is fifth intercostal space, mid-clavicular. So I'm going to do that with the bell of my stethoscope. Okay, so when I do this, I'm going to have you breathe in and then breathe out and hold it. Okay?
Yep.
All right. I have you sit up. So rate and rhythm was normal. S1 and S2 were normal. There were no adventitious sounds, no murmurs, no bruits, nothing abnormal there. Now I'm going to listen to pulmonic sounds. So when I do this, I'm just going to have you breathe in and out, and let me know if you need a break, okay? So I'm going to start above the apices of the lungs with the diaphragm of my stethoscope. So right above the clavicle. So that was normal. I heard bronchiovestibular sounds. There was no wheezing, no crackles, no rhonchi, or no rails. And the sound did not diminish as I went down, which is a good finding. Now I'm going to percuss the anterior chest, starting above the sternum. Let me know if there's any tenderness, okay? Okay, so the sound was tympanic. There was no dullness. When I percussed, I did it in between the intercostal spaces, so that I could listen to the lung fields. I'm also going to palpate the chest just to check for any masses or any fremitus. So there's no fremitus and no masses that I could feel. I'm going to move to the posterior chest now. So I'm going to have you turn around actually. And I'm going to begin by checking for fremitus and palpating for any masses. So there was no fremitus or crepitus. Frepitus, there was tactile fremitus. There was no crepitus though. I don't know if I said that for the anterior portion of this video, but there was no crepitus, but there was tactile fremitus. I'm going to check for tactile fremitus now. So can I have you say 99?
99. 99.
Okay. So as I went down, the vibrations diminished. The tactile fremitus diminished. Looking at the back posterior chest. There is no bruises or any lesions or anything like that. The skin is intact. It is consistent with ethnicity. It's consistent with the rest of the body. It is warm and dry. So now I'm going to auscultate for lung sounds. And I'll have you take a break there for a moment. And now I'll listen to the other side. Okay, so there was no crackling or wheezing, no rhonchi, no adventitious sounds. All the sounds were bronchiovestibular. So now I'm going to palpate the posterior chest. And when I'm palpating and auscultating, I'm going to try to avoid the scapula because it will sound dull over bone. The last thing, or one more thing that I'm going to do is check the AP diameter, which is the anterior posterior diameter, by measuring this and comparing it to the back. Okay, and it is half of the back, so it is 1-to-2 ratio. So somebody with COPD may have barrel chesting, and then the ratio would be 2-to-2 because the lungs are working so hard to breathe that the chest muscles begin to get bigger and the chest expands, and then you have that 1-to-1 ratio. Okay, so I'm going to have you turn towards me now. And I'm going to do the abdominal portion of this video now. Do you have any abdominal pain?
Nope.
No. When was your last BM?
BM?
Bowel movement.
2 hours ago.
And was it formed?
Yes.
And what was the color of it?
Brown.
Okay. And is that normal?
Yep.
Okay. And how often do you have a bowel movement?
Every day.
Okay, good. Do you ever have pain when urinating?
Nope.
Do you ever have bleeding?
Nope.
Do you ever have bleeding in your in your stool?
Nope.
Do you ever have mucus in your stool?
Nope.
Do is the frequency of your bowel movements about the same?
Yep.
Is the frequency of your urination about the same?
Yep.
Okay. And can you tell me what you had to eat in the last 24 hours?
Tuna, avocados, pretzels, hummus, mashed potatoes, gravy, rolls, green beans, meatballs.
So I'm noticing a trend that there is no fruits in your diet. So I'm just gonna suggest that you try to add more fruit to your diet to just make sure your diet is balanced.
Okay.
Do you ever have any nausea?
Nope.
Any vomiting?
Nope.
Any diarrhea?
Nope.
Constipation?
Nope.
Okay. And do you ever notice any distension of your stomach? Any bulging?
Nope.
Okay. So now I'm gonna have you lay down for this part of the assessment. So looking at your neck, it doesn't appear that there is any jugular vein distension just laying flat. Now I'm going to have you sit up at 45-degree angle, or at least try to. Again, there doesn't appear to be any jugular vein distension. Move. No jugular vein distension. So I'm going to now inspect your stomach. So looking at it, the color is consistent with ethnicity. It's consistent with the rest of the body. The hair is evenly distributed. It is warm and dry. The umbilicus is the midline. It's inverted. The stomach is slightly rounded. It doesn't appear that there are any masses anywhere. It looks pretty symmetrical. So I'm going to listen to your renal, iliac, and aortic valves, or not valves, but arteries, using the bell of my stethoscope. It's going to be somewhat of a W shape when I listen. So I didn't hear any bruits or murmurs when I listened there. There doesn't appear to be any vein distension. So now I'm going to listen to bowel sounds. And I'm just going to listen for a little while, just so I can get a picture of what they sound like. And I'm going to start in the right lower quadrant, and if there was any pain, I would do that quadrant last, which there's no pain. Okay, so bowel sounds were active. They were not hypoactive or hyperactive. I'm now going to percuss the abdomen, starting in the right lower quadrant. Let me know if there's any pain or tenderness. and the sound is tympanic. There was a little bit of dullness above in the right upper quadrant where the liver is, and you'll normally get a little dullness if there's an organ or a bone there. Okay, so the next thing I'm going to do is palpate the abdomen, and let me know if there's any pain. So I didn't feel any masses. So I'm not going to do a deep palpation in this video because the data didn't. There's nothing that prompted me to do it. So I'm not going to do deep palpation. Okay. So next I'm going to check the Babinski reflex. Okay, so I'm just going to take your socks off for a moment. Okay, and the Babinski reflex is positive. While I'm also down here, I'm going to check capillary refill on the toes. And capillary refill is less than 3 seconds. I'm going to have you push on my hands and pull back. Okay, so he's got normal range of motion and normal strength in his legs. Checking the bony prominences, there is no edema. I'm going to check the dorsalis pedis artery. So it is equal bilaterally plus 2. Now I'm going to check the dorsalis pedis artery. So that is also equal bilaterally plus 2. The toes are warm and the legs are, which it would indicate good circulation. I'm also going to check the popliteal arteries. I can't find those ones, but that is not abnormal not to be able to find them. It is pretty hard to find those. Put your socks back on you. And looking at the legs, they're symmetrical. There's no swelling in them. And for the femoral artery, I would normally do that, but I'm not going to for this assessment. So I'm going to have you sit up now. And I'm going to look at the arms. In any of your extremities, do you have any pain?
Nope.
No. Any swelling that you notice?
Nope.
Any limited range of motion?
Nope.
No. Okay. So now I'm going to check capillary refill of the hands. Okay. And capillary refill is less than 3 seconds. I'm going to check the radial pulse. And that is equal bilaterally plus 2. And the brachial pulse. that is equal bilaterally plus 2. Checking the bony prominences of the arms, it appears that there is no edema, and the arms look symmetrical. So again, no edema. Doesn't appear that there's any edema. Okay, so now I'm going to have you stand up. Do you have any joint pain?
Nope.
Any muscle pain?
Nope.
Any bone pain?
Nope.
Okay, good. Any limited range of motion?
Nope.
Okay. So I'm going to have you close your eyes and just stand still. Okay, so that's a positive Rombert test. He wasn't swaying or anything when he closed his eyes. He has good balance. Now I'm going to have you take your heel and move it up your shin. And now the other one. Okay. Now I'm going to have you take your hand and extend both your arms and extend them outwards, and then touch your nose with one of the hands, and now the other. Okay, so you have good coordination and balance. I'm now going to have you walk over to the wall over there and walk back. Okay, so his gait was steady. He didn't need any assistive devices to walk. His range of motion is normal. There's no limitations in that. I'm going to have you push on my hands and pull back. And I'm going to have you grab my fingers. Okay. So his grip strength is good. He's got range of motion in his wrist. He also has good strength in his wrist as well. I believe that concludes our video. You can have a seat now. So from this point, I would make sure that my patient is in a comfortable position. I'd make sure that he has non-skids footwear on, his call light is within reach, the bed is locked and in place, the table is by his side, anything that he might need is by his side, and just making sure that he is comfortable and safe is the most important thing. Okay, thank you for watching my head to toe video.